Hey, Ashley, thank you. For almost a year, COVID-19 has been an uphill battle for our state. Through it all, Hartford Healthcare has been nonstop caring for patients. Joining us now is Dr. Laura Saunders, Clinical Coordinator of Young Adult Services, the Institute of Living. Thank you so much for being with us today.
Thank you for having me.
So let's start right away with how Hartford Healthcare addresses the issues of mental fatigue and wellness among your frontline workers.
So this is a real thing. I mean, what we know is that, 50% of people are really struggling. The concern is always isolation, and COVID is all about isolation. Isolation is like gasoline on the fire of depression. So it's finding alternate ways to connect with people. I think we were more energized to do that in the spring, but isolation is still a very significant problem. And I think, we have our HHC Community Care Center. It's for COVID resources. It's for mental health resources. Mental health is a serious problem. It's always been, but it's finally getting now because it is really getting worse.
And you kind of touched on it a little just then, but what are the other tools to help build this resilience?
So, I mean, it really is, it's finding points of connection, finding alternate ways or different ways to connect with people. It could be online forums. It could be attending your church service via, Zoom. It's doing different things. It might take a little bit more effort to reach out and connect because I think everyone's struggling a little bit. But, it's the issue of gratitude, finding meaning in what you're doing. This is a difficult and dark time, but we have to build our resiliency and find a little bit of grit in this situation.
And Dr. Saunders, we only have a little bit of time left, but we want to touch on the roundtable tomorrow at Hartford Healthcare. What can we expect to see? We understand you'll be a panelist there.
Yes. So, it really is about Jeff Flaks and the whole leadership team being committed to openness and transparency and communication, trying to be at the forefront and in a leadership position around being as open as we can and providing information in real time.
Dr. Saunders, thank you so much for joining us today.